Hello, good morning, good afternoon, or good evening to everyone who is joining us in this live today. The theme of today's discussion are COVID-19 vaccines because last week, actually last Friday, WHO approved one more vaccine, Sinopharm vaccine for emergency use listing in the COVID-19 pandemic. As usual, I am joined by Dr. Kate O'Brien, WHO Director for Immunization, Vaccines, and Biologicals, and Dr. Alejandro Cravioto, who is the chair of the WHO Strategic Advisory Group of Experts for Immunization, and who is a professor at the Medical University in Mexico City. Good morning, Dr. Alejandro, and good afternoon, Kate. Thank you for your time to join today. I would just use the chance to invite our viewers, if they're watching us on Twitter, to ask their questions by using the hashtag AskWHO. If you're watching us on other platforms, please leave your comments via comment section, and I will pass them to Kate and Alejandro. As I announced, the theme of today's discussion are Sinopharm and other COVID vaccines, as this vaccine is newly approved. So, Kate, maybe you can start by telling us more about this vaccine, its technology and effectiveness.
Sure, Alex, happy to do that. So this is a vaccine that uses a different platform than the other vaccines that have achieved emergency listing and recommendations from SAGE. This is a vaccine that is an inactivated whole virus vaccine to inducing from your natural immune response, your own body's immune response is to respond to this product so that your body has those immune defenses if and when you're exposed to the actual virus. Just taking the virus and eating it, so it cannot cause disease, it cannot replicate, but it still has the little spikes on the outside of the virus against which your body's immune system responds. So that's vaccine works. And it's the first of this. There are a number of products who use this strategy, but this is the first one of this strategy to achieve emergency use listing and SAGE recommendations.
Thank you, Kate. And as usual, the Strategic Advisory Group of Experts have met to provide the world and governments with recommendations on how to use this vaccine. So, Alejandro, can you please explain to our viewers who are the population groups who should receive this vaccine?
Yes, of course. This vaccine is 2 doses of an intramuscular shot in the arm of this inactivated vaccine that Dr. O'Brien described so well for people who are 18 years and above. The data that we have reviewed at SAGE for people over 60 is really very scarce so far. But we know that there are 2 other studies that are being conducted at present that might give us a better idea of the immune response and the reactogenicity of people above 60 years of age. But given the information that we saw and the few people above this age that have been vaccinated, there's no reason not to recommend the vaccine for all age groups above 18 years of age. The 2 doses have to be given within a frame of 3 to 4 weeks. And the 2 doses are needed in this case to be able to achieve 14 days after the second dose a full protective effect that goes up to 79% in the clinical trials for people who have symptomatic COVID and people who have severe disease in that sense. So it is comparable to other vaccines in the sense of efficacy, and the safety profile doesn't give anything that would be worrying in the sense of its use.
Thank you, Alejandro. And do we know if this vaccine can have any side effects?
All vaccines have a side effect. There's no reason to think you can have pain in your arm, you can have a bit of fever, you can have not feeling well for a few hours or a few days. But that's a normal part that we all know because it's the way your body is responding to this antigen. So far, we haven't seen any safety concerns except for very mild type of responses. So in people who who have been vaccinated with this product. It is therefore something that we continue to review, and we have asked the countries that are already using this vaccine to make sure that they have the necessary pharmacovigilance systems in place to be able to detect any long-term side effects with the use of these vaccines.
Thank you so much, Alejandro. And WHO has already approved a few vaccines before this one for emergency use listing. Kate, are there any other vaccines being under review to be added to this emergency use list?
Yes, absolutely. First of all, WHO is working with any manufacturer that has contacted WHO to have considerations for emergency use listing. The ones that we are engaging in right now, so additional products that are in rolling review, where we're in discussions with manufacturers about what data submit, or we're actually reviewing the data that they have submitted. So for example, a Sinovac product is under review. There are also discussions and review going on of the gamma lady is what I'm referring to. In addition to that, there are manufacturers, CanSino, as well as Novavax manufacturers. And we provide a spreadsheet that shows on our website that shows the progress of manufacturers along the different steps that ultimately results in an emergency use listing. So that's publicly available for people to look at. It's updated on a weekly basis, but those are some of the ones that are discussions with WHO by the manufacturers or under data review.
Thank you so much, Kate. And I'm seeing here questions coming in particular about Sinopharm vaccine. How about the newborns and pregnant women? Do you think that these groups could be considered for vaccination?
Alejandro, do you want to take that one?
So far, we have no studies done in pregnant women with this vaccine, but the safety profile doesn't show that it would be worrying to use it if the women, as we have said before, are at a higher risk of being infected with COVID, which we know is far more severe in a woman who's